In today's health headlines, April is C-section Awareness Month. More on why a C-section may be necessary and will the anesthesia affect your baby, and also what to expect during recovery. Joining us now is Dr. Kathryn Campbell, Yale Medicine Maternal-fetal medicine specialist and associate professor of obstetrics, gynecology, and reproductive sciences at Yale School of Medicine. Welcome, doctor.
Thank you so much.
So what are some of the most common reasons a C-section could be necessary?
Sure. I think it's a question I spend a lot of time talking to patients about. For patients who are planning a vaginal delivery, the most common reasons that your birth might end up as a cesarean would be that maybe your cervix stops dilating, and ways to get it to dilate more just aren't working. Another reason is that when you're pushing, the baby's head might stop coming down, and we might switch to a cesarean delivery. Sometimes, too, in labor, it can be a little bit stressful for a baby, and we might have to stop the labor process and move to a cesarean as a safer mode of delivery for the baby. And there's other reasons of a person needing a C-section that you would talk to your midwife or doctor about. One important was if the placenta is covering the cervix, that would be a reason why your baby would need to be delivered by cesarean.
So there's always some fears that can come along with that possibility. What kind of anesthesia do patients get during a C-section, and does it affect the baby?
Great question. Cesarean delivery is one of the most common surgeries performed across the United States in our operating rooms. And so for that reason, we have a lot of really good data informing us of how to give anesthesia and how to give anesthesia safely. The preferred method and sort of our first choice is some type of spinal anesthesia. So that could be just a regular spinal that the anesthesiologists call it. It could be an epidural. So if you're in labor, that same epidural can be dosed up, meaning more medication is given through that catheter, and so you can use your epidural. Sometimes, too, an anesthesiologist might choose to do the combination of them, and that is called a CSE, so just a combined spinal and epidural. If for some reason it's actually safer to not do any type of anesthesia in the spine, we can still have the option of general anesthesia.
So what can new moms expect in those first days and weeks after a C-section delivery? Give me a sense of the recovery process.
Sure. And I think, too, one of the benefits of C-section being common is that we have a lot of good information informing us of how to do recovery the best way. And many patients might hear about something called ERAC, or enhanced recovery after cesarean. That's something we practice here at Yale New Haven Hospital. And what that means is that we think about the body's just sort of natural recovery mechanisms and normal physiology to help our patients recover quickly and make that more smooth transition to being home with their baby.
Dr. Campbell, I do appreciate all your information. Unfortunately, we're running out of time. Thank you. There was so much good info in there.
Thank you so much.
Dr. Kathryn Campbell, Yale Medicine Maternal-fetal medicine specialist. We appreciate you joining us today.
Thank you.